The neonatal brain is the most vulnerable period in our life, but also the neonatal brain has the most possibilities of plasticity. And I went to Children's Hospital in Boston and I did a fellowship of fetal and neonatal neurology. It captured my attention and I said, I have discovered what I want to be in my life. And nowadays I dedicate with a lot of passion, I must say, to take care of neonatal patients with neurological problems, but also epilepsies, most of them of genetic origin, that have an onset the first 2 years of age. The neurology department is a big area. We are more than 45 pediatric neurologists, and we attend two types of patients. So we attend patients with, we could say, low complexity, but also we have several units of reference in our area, reference in Spain, and also participating in ERNs, European Reference Networks. These areas in the department, for example, complex epilepsy, neuromuscular disorders, neurometabolic disorders, annually we see more or less 22,000 patients in the department. Most of them are low complexity, but we could say that 2,000, 3,000 are patients with rare and complex disorders. The international patients that come to our hospital for a second opinion usually are patients that are looking for a diagnosis. They have complex neurological problems and they want a diagnosis because in their hospitals or in their countries they didn't get the diagnosis. And on the other hand, they have a diagnosis and they came to us just for a better treatment, better care, multidisciplinary evaluations. These are the two profiles. So the challenges for a pediatric neurologist are two. The first is to get early diagnosis of these patients, because if we have early diagnosis, then we can treat them with which kind of therapist. Most patients in pediatric neurologists, we cannot offer a specific treatment, but we can offer the best multidisciplinary care to improve the quality of life. But in a group of patients nowadays, with the new advanced therapies, gene therapy, RNA therapy, or other personalized therapies, we can offer them these treatments. So as early we diagnose them, as early we can put them in advanced therapies programs. At this point in neurology, we have more or less 50 clinical trials. These trials that I mentioned are based on advanced therapies. And we can also offer here in our hospital, as the only center in Spain, we offer gene therapy also for MLD, metachromatic leukodystrophy. So we have changed the life of these patients, and all these new treatments has been able because we have early diagnosis. When you have a new diagnosis, you don't know that gene because it's rarely reported, and then you study the physiopathology of that gene, the dysfunction that provoke in the brain. After your study, you decide that one medication could work. You ask a family, you ask a consent for non-indicated treatment, and you treat the patient after a long time of study, and then this patient improves. You can change the natural history. This patient is improving motor skills, language skills. This is a big satisfaction.